I really appreciate the opportunity to be here and talk a little bit about one of my passions. I would love to have no work. Let me be clear, I would love to have no patients who need to be seen, to be taken care of for their melanoma. So that's one of my goals, to try to see what we can do to accomplish that goal. One of the enormous privileges of working here is the ability to participate with our Melanoma Moonshot initiative. And that's a way to get projects off the ground that may not otherwise be fundable. And one of our flagships for our Melanoma Moonshot is our primary prevention and early diagnosis platform. And I have the distinct pleasure of working with Dr. Gershenwald to help lead the efforts of that program. And we come right out and say we want to reduce incidence and deaths from melanoma through the course of early diagnosis and prevention. When we talk about melanoma prevention, we sort of organize our thoughts into two camps. The first is primary prevention. How do you keep melanoma from happening in the first place? And then the second is secondary prevention. Melanoma is going to happen, but how can you diagnose it sooner rather than later? With primary prevention, I'm going to go through both of these topics, and I'm trying to organize this in ways to first talk about things that are most directly applicable to you and your ability to go forth and enact change. And then to advance the topic to what are we doing as a team here at MD Anderson on these fronts. So let's talk first about primary prevention. One of the counseling topics that I frequently cover with my patients is how can they personally reduce the risk of having an additional melanoma, and reflexively, how can they help their family and their loved ones reduce their risk of going through the same journey that they're facing at that point in time. And about 5% to 10%, depending on what you look at in the literature, of people who make one melanoma will make a separate and distinct second melanoma somewhere else on their body. So the odds are pretty good that you won't have a second one, but hopefully if you do, it's caught sooner rather than later. So how can you reduce your risk? Still living your life, but trying to be smart about protecting your skin from the sun. Making sunscreen part of your daily routine. I think perhaps the type of sunscreen is less important than just getting enough on. So getting the full amount to get the full SPF protection requires 2 ounces of sunscreen. That's a lot. You think about the typical tube of sunscreen from Neutrogena, it's about 6 to 8 ounces. So how many applications are you going to get out of that tube? Not very many. And most people don't get that full quantity on their body. Trying to skew your activities to be earlier in the morning and later in the day. Leveraging sun protective clothing is really important, especially if you have little ones. And then trying to incorporate umbrellas and tents and protective structures if you have active young ones who have activities outside. And I say all this, and I also want to say explicitly that not all melanoma is sun-induced. The majority of it is. But there are some melanomas that happen on areas that have never seen the sunshine. There are melanomas that happen in children. There are melanomas that happen that fall outside of this particular risk factor, yet it's still important to talk about. Behavioral engineering really helps on this, so trying to make it idiot-proof. So having the sunscreen in a bucket right by all the doors out to your house, trying to have hats in your car, trying to model effective behavior for your loved ones. So with my kids, they really don't have a chance, right? This is all I do is melanoma. And so from the time that they were born, they know that when we go outside, they're always wearing hats. And as much as we can, we try to wear long sleeves. And so that's just part of the culture of our family. So this is my family at the beach. We're at Galveston. And so you can see that it's an overcast day. You can see that all of us, with the exception of my future nudist toddler daughter, have on sun protective clothing. We have on hats. We have our sunglasses. This is just how our family does the beach. In addition, it's later in the afternoon, which is hard to tell because it's an overcast day. This is perfect dermatologist beach weather. And then you see the umbrellas in the background. We've set up camp underneath an umbrella. The sun protective clothing, like this little suit this is my son, even though he's wearing one of my daughter's outgrown hats here. These are really handy for kids because you just zip them up and then you just have to wrestle sunscreen onto their face, their hands, and their little fat feet. And that's a lot easier than doing the whole scene. We go to the beach. We actually do go to the beach for a week every summer with our family and our close friends. And this is how we do it. This is our dedicated beach pop-up umbrella that we set up shop. And then you can tell by the shadows that the shadows are pretty long here. So we try to do the beach first thing in the morning, have lunch, have naps, and then go back out. And this is my dad. My dad's had a couple of non-melanoma skin cancers, but he loves to kayak. And so this is his get-up for kayaking at the beach. You can't see that he actually has gloves on to protect his hands, and the only reason I let him get away with wearing shorts is that his legs are tucked underneath the kayak. Additional things that you can do in terms of your communities is access to this amazing sun protection education platform that has been developed here at MD Anderson. In the interest of time, I'm going to sort of scoot through this, but there's age-specific curriculum that's available for free. This is the website. This is a really neat exercise. Are our shadows long? This is geared for pre-K. So the kids go outside first thing in the morning, they draw out their shadows, then they come back outside later and see, wow, my shadow's a lot shorter. So it's using scientific educational content to help reinforce the behaviors that we want them to accomplish. This has been a major work of Dr. Gershenwald's, engaging in state legislation to support legislation to reduce the exposure of minors to tanning beds. So if you're under the age of 18, you shouldn't be able to get into a tanning bed. And it has shown reduction in risky behavior for young children as part of this survey that's done every year by the CDC. All right, so let's go on to secondary prevention, which is trying to catch melanoma sooner rather than later. So this is what I commonly hear from patients, if I do make a second melanoma, how can we catch it quickly? Finding someone to take care of you who is comfortable using total body photography, who is comfortable using a dermatoscope, who is able to take clinical and dermoscopic photographs of things they are biopsying from your skin. Those are markers of excellence for someone who is good at finding melanoma. For your end, looking for something that doesn't look like the rest of what you have on your skin and something that is changing are easy take-home points for how you can help monitor your own skin. How do you make sure that your melanoma isn't coming back? Checking your skin yourself, palpating around your excision site. When cancer comes back, it tends to feel like a hard, dried-up pea under the skin. It's a very specific feel. And then feeling your lymph nodes if you've had a lymph node biopsy. And how do you keep yourself from going bonkers in the meantime? And anxiety management is a not insignificant part of my practice, especially for young patients with young families. And so for those patients where I hear a lot of anxiety from them, we have a whole routine that we do where I see them back more frequently so they don't have to be consumed with worry about their skin in between their visits. And then as they gain confidence, we're able to slowly graduate them out. My goal, though, is to help keep melanoma from happening and reduce people's deaths from melanoma beyond just the patients who are under my care. There are a lot of words on this slide here, but basically the U.S. Preventative Services Task Force does not recommend skin cancer screening for people who have not had melanoma and who are asymptomatic. There was a big study out of Germany, and it's interesting to look because the big study that was done was out of this tiny little region right here. And where are we? We're in the enormous state of Texas. So one of my main research initiatives has been to teach dermoscopy to dermatology residents across the state of Texas. So one of these is a melanoma. One of these is a fairly innocuous basal cell carcinoma that's not going to kill anyone. But the melanoma that's there has already spread to this patient's lymph nodes. The one on the left is the melanoma, and if you have some degree of comfort with dermoscopy, you can tell based on the dermoscopic appearance which one is which. This is our teaching group that we've developed where we have all of these academic dermatology programs. We do monthly teaching sessions. We have bounces between 80 and 90 participants. And here I am here in the lower corner, and this is the teaching room, and then all of these people are remoting in to hear the content of my lecture. We measure this up the wazoo. So we have a lot of metrics to help show that the education that we're providing is working. And that is it.